This segment of Delmarva Life is brought to you by Community Behavioral Health.
I think we can all agree that there is quite a stigma attached to mental illness. It's often mocked and put in a negative light.
Did you know that studies show that mental illness impacts 1 in 5 adults? Chances are those numbers include somebody you love. It may include you. So how about we stop with the stigma? One person who is working to do just that is Dr. Suni Jani, a psychiatrist at Community Behavioral Health. Thank you so much for joining us this afternoon.
Thank you for having me.
You are really passionate about this. Why?
Well, that's a great question, because a lot of people don't realize that stigma is a barrier to healthcare, and we often think of it as something that's shameful that we shouldn't talk about, and we sort of leave it at that. But you know, on average, if someone's diagnosed with diabetes, or has a symptom of diabetes, it's about 90 days till they get treatment. But if you notice a symptom of a mental health condition, and they're pretty varied, it's pretty different based on what condition it is and other factors in a person's life, the average is 9 to 12 years before getting treatment.
Wow.
And for us, you know, time is brain, time is recovery. And so the sooner you catch it, the sooner you recover. But the longer it takes, the harder the whole process becomes for a lot of people. And the reason for that time is usually the stigma associated. So people don't want to acknowledge the feelings they're having as something that's, you know, not societally acceptable, something they can't share with, definitely not in their community, and sometimes it's very hard to share it with family members. So, and there's so many different types of stigma that come in so many subtle and obvious messages.
Yeah.
So I think it's something to talk about.
Absolutely. And you've actually started a nonprofit that addresses breaking that stigma.
Yep. I think, you know, I wanted to start this nonprofit to be able to serve communities, underserved communities specifically, because one of their great barriers, apart from access, is the stigma. And so what we do is we try to teach people about symptoms of mental health conditions, different types of treatment options, and to make it acceptable for families as a whole.
Do you think people just don't understand mental illness?
Yeah, I do not think people understand mental illness. I think we have a long way to go before people are able to talk about it in an appropriate manner that normalizes it. And, you know, like you said, it's 1 in 5 adults. So there's a lot of people, even if that's, you know, at least 1 in a 5-member household who don't come and get the help that they need.
But we have made some progress. Do you think we are starting to break the stigma a little bit?
I want to say so. I think, you know, I work here at Community Behavioral Health, so I see a lot of families, and it's been remarkable when just one person is able to stand up and say, I'd like to get help, and they come to our clinic, or they, you know, go somewhere, maybe speak to a school counselor or even a pastor, are able to acknowledge, I need to do something about this mental health condition I have. It spreads in that way. And so we start to see more people go, you know, I saw someone that was able to get help and it inspired me. So it's been incredible to see that in my patients and some people I know. Yeah.
Now, just because you have a mental health issue does not mean you can't have a fulfilling life.
Yes, very true. It's many people who live incredibly fulfilling lives and have mental health conditions, and they're right in front of us, but because it's the invisible illness, we don't talk about it.
And real quickly, your passion has led you to write a book.
Yes.
Tell us about it.
So at one point, I was very fortunate to be able to work with refugees during my training, and I was incredibly inspired by this population. They are amazing, they're resilient, they bring so much to their communities, and they're known, what makes them who they are is that they experienced a mass trauma by being forced out of the country they grew up in. So imagine really loving the community you're in and then being told you can't be a part of it. It's traumatizing.
Yeah.
And it shakes your whole identity and your whole way of life. And when they leave, they do an amazing thing by finding a new version of themselves in another country, but they need help.
Sure.
So, you know, the patients that I'm very privileged to serve inspired me to write a book like this. So.
And your nonprofit is called Global Health Linkages Incorporated.
Yes.
Dr. John, thank you so much.
Thank you for having me.
Absolutely. Thank you.